Hello and welcome to Health Affairs This Week. I'm your host, Jeff Byers. It's October 31st, 2024. Today we will be talking about ballot measures at the state level. But first, I want to highlight two events that we have coming up. On November 7th, we have an event for everyone on the financial integration of Medicare and Medicaid. Necessary but not sufficient is the colon after the title. So we'll be talking about the integration of Medicare and Medicaid. That's on November 7th. It's open to all. And then on November 20th, for Health Affairs Insiders, we have a journal club on nursing home financial stability and funding challenges. And that will be with Walter John Balbus. So please join us for either events if you can. If you're not a Health Affairs Insider member and if that sounds interesting to you, please sign up. Today on the program to talk about state ballot measures, we have Rob Lott. Rob, welcome back to the program.
Thanks, Jeff. It's great to be here.
So we're not really a politics podcast, but I'm going to ask you how, and so I'm going to get there. So
all right,
follow this yarn with me. From a scale from just to extremely, how online are you?
I would say, I'd say a 6.5 out of 10, maybe.
6. Okay.
Yeah.
So have you seen the photo of 1980s Tim Walz on Twitter?
No, I have not.
Oh, wow. Okay. I don't know if this joke will land then, but I wanted to know what you thought 1980s Tim Walz, would have thought about Wilco's Yankee Hotel Foxtrot.
Oh, my goodness. He probably would have thought that it was a little too experimental.
Okay. He's more of a summer teeth guy.
Yeah, think? Exactly. Yeah.
Check out the photo and check out the photo. Yeah.
All right. I can't wait. Yeah.
Yeah. You were recently in DC, right?
Yeah, I was.
How was that?
Oh, it was great. I lived in DC for many years, and
that's right.
A while ago, moved to Chicago. Love it here in Chicago. Love Wilco, as you've just mentioned. But it's always good to be back in DC.
Yeah, I wanted to ask you, what's the difference between Chicago and DC? And then I was going to try to bait you into whether DC should be a state. But I think before we get into the state ballot measures, what I really want to ask you is, where do you think the Northeast begins? As a former coastal elite, where do you think the Northeast begins?
Yeah, well, so not only did I live in DC for many years, but I grew up in Connecticut. And so I would say Northeast begins probably... to be honest, I'd consider Baltimore part of the Northeast. I know it's also Mid-Atlantic. Yeah. But basically anything north of DC.
Yeah. I don't think DC is Northeast, but it's definitely Mid-Atlantic. And then I thought maybe Baltimore, but Philadelphia is where I'm Northeast begins.
Oh yeah, that's solid Northeast. Yeah.
So I can't tell if it begins in Baltimore or Philly, but I think we're on the same level. I've heard some people try to claim Fredericksburg as Northeast. I'm like, get out of here.
Yeah.
Anyways.
It's too far from the ocean on that. Well, sorry. I was thinking of Frederick, Maryland. I know we're way off base here, but Fredericksburg.
We're really getting those Beltway Insider listeners amped up. And
that's right.
On that, I wanted to ask you, so now you're in Illinois. Are you tracking anything at the state level this election season?
It's been interesting. For the most part, Illinois is a pretty tame state in terms of the presidential election. It's going to be solidly blue this year. The most exciting for me when I go to the ballot box is actually going to be the City of Chicago Board of Education election. This is the first time that voters will be allowed to choose the members of the City Board of Education. And surprise, surprise, folks have gone all in. There's been a lot of money spent on these spots. My mailbox is full of flyers, and it's a little overwhelming. Glad to have the opportunity to vote on it, and we'll see how it comes together on Tuesday.
Nice. Well, yeah, that's a great example of, while there's a lot of focus being put on the presidential election, there's a lot of ballot measures at the state level that people really care about, especially at the community level. Some of these measures are health related. We published a brief this year on ballot initiatives. I know you worked very closely on that brief. What are some of the main things that people should know about that?
Yeah, absolutely, Jeff. Thanks. And credit to my colleague, senior editor Laura Tolan, who was the real driving force behind that brief, and the authors, Paula Lance and Emma Carter from the Ford School of Public Policy at the University of Michigan. This is a really interesting brief, especially around this time. The authors looked at the role of how a state health policy is shaped by ballot measures. And they basically looked at 534 state referenda and constitutional amendment ballot initiatives on all topics that passed nationwide between 2014 and 2023. They categorized them and determined that 63% of those successful ballot measures were related to health in some way. And so if folks aren't thinking about ballot measures as one of the pathways for shaping health policy, they're snoozing. They're sleeping.
Yeah. So, what were some of the common topics that were on these ballot measures?
Yeah, I mean, it's no surprise, obviously, ballot measures related to abortion, Medicaid expansion, decriminalizing marijuana, environmental exposures. Those are the kind of things you typically see on a state ballot. And so no wonder health really is the common thread you see in a lot of these ballot measures.
Yeah. So I'm hoping this is a fair question, but how does this fit into like federalism and separation of powers for healthcare, which is ultimately a profit-seeking business in the U.S.?
Yeah, so there are, sort of two ways a ballot measure ends up in front of voters. One is that it's initiated by a state legislature, and the other is that it's initiated by citizens. And different states obviously have different rules and processes for getting on the ballot. And so only 26 states give citizens some form of direct democracy power. And even in those, we're talking about a lot of work that goes into getting these on the ballot, major organizing, advocacy, resources just to get on the ballot, and let alone to convince voters to support it. And so there's a sense that there's sort of pros and cons to having direct democracy as sort of an avenue for state health policy making. One is that there's sort of a barrier to entry, and certain folks with more power or more influence may be more successful in getting their issues on the ballot. Another sort of challenging issue is the question of whether or not citizens are the optimal parties to be making policy. They may not sort of fully appreciate the nuances at the sort of the deeper policy level. And so there are opponents who say that, we elect our representatives for a reason to make the laws. Let's rely on them to do that work. And then lastly, the question you sort of hinted at in terms of healthcare as a profit-making enterprise is there's a lot of money. When you put a measure on the ballot, it's one more sort of point of entry for folks to try to influence and step in, spend money, and shape the outcome. And so I think that's a lot of what's at stake here when not everyone is thrilled at the idea of being able to have all these issues on the ballot.
So thanks. Go ahead.
Oh, sorry. I was just going to say one other thing, Jeff, is that there's sort of been a trend in the last few years of some legislators trying to impose additional barriers to getting these kinds of measures on the ballot. And so we're talking about increasing the number of signatures required or imposing other obstacles to having those signatures verified, all that kind of those sort of factors. A recent health policy political science researcher noted that these efforts have increased and that they're often taking place in Republican-controlled legislatures, frequently as a response to successful referenda that they disagree with.
So with that context in mind, thanks for laying that out for us. What are some of the health-related ballot measures you're tracking this year at the state level?
Yeah, so as usual, it's a busy year, a busy October, November as folks get close to Election Day. There are 10 states nationwide that have abortion-related measures on the ballot. Most of those are strengthening the protections for women to access abortion. Not all of them, though. There are 4 states that have cannabis on the ballot. Again, most of those are sort of relaxing restrictions on access to cannabis. Those are sort of the most common initiatives and why you see them in multiple states across the country.
So this isn't the first year we've seen cannabis or abortion on the ballots. Are there any other notable ballot measures that may be unique this time around?
Yeah, Jeff, I thought I could highlight just a few that might be of interest to our listeners. One of them is the Amendment F, Constitutional Amendment F in South Dakota, which would allow for Medicaid work requirements under expanded Medicaid. Now, our listeners may know that South Dakota expanded Medicaid with a constitutional amendment in 2022. And by the way, that Medicaid expansion included a prohibition on imposing additional requirements or restrictions on eligibility or enrollment. But now state lawmakers are interested in maybe adding work requirements to their Medicaid expansion. And so they're basically asking for that option. Now, it's worth noting that it would be highly unlikely for the Biden administration or a Democratic administration that might follow to allow work requirements. But if there were a Republican administration going forward, the legislators sort of want to reserve that option.
Yeah, so correct me if I'm wrong, but the work requirements measure kind of came out in the Trump administration. Is that correct?
Yeah, that's right. The Trump administration, CMS under Trump, approved 11 state proposals to implement work requirements, but they mostly got caught up in litigation. A few of them briefly took effect. But then in early 2021, the Biden administration basically withdrew approval of those plans. And so we saw it in effect for a few months in Arkansas, and there's a version in Georgia. Neither of them have been especially successful. So this is sort of take 2 or 2.0 version of work requirements.
And have we seen anything about the impact of these work requirements so far?
So in Arkansas, where the work requirements were in effect, it actually led to quite a few folks losing coverage, either because of paperwork issues, or in some cases because they couldn't attest to being employed. And so in that respect, there's a sense that the work requirements as implemented were not really successful.
Okay, what else you got for me?
Yeah, I also want to point listeners to a ballot measure in Washington State, which would allow folks to opt out of their long-term care program, also known as Washington Cares. When the program was created in 2019, it established a payroll tax. And then in exchange, beneficiaries will have a lifetime benefit of up to $36,500, which they can spend on long-term care. It's supposed to take effect in 2016. But this ballot measure would essentially allow folks to opt out. And so what you have there is basically an invitation to adverse selection. If enough people choose to opt out, they're not going to be paying into the program, and the program finances will suffer as a result.
Yeah, okay. I was about to ask what might this mean for the program sustainability?
Yeah, so it's this is really a mechanism for the opponents of the program to kind of pull the rug out from under it. So we'll see what happens, and it's going to be interesting. Right now, Washington is the only state with a long-term care insurance program like this. And as you know, they tried to include it in the Affordable Care Act with the Class Act, and that was a bust as well. So the saga continues, still trying to figure out how to address this from a public sector perspective.
Okay, and take us on down the maybe Zypher train. I can't remember which one. Maybe the Silver Line. Take us down from Washington to the Golden State. What's happening in California?
Yeah, as always, some interesting ballot measures in California. The one that caught my eye is Proposition 34, which would create new rules for how certain healthcare entities that participate in the 340B program can spend their revenue. Now, just as a reminder, the 340B program basically allows healthcare providers that provide services to low-income and vulnerable populations to buy certain drugs at a significant discount, and then, in theory, provide them to the people in need. But they're also allowed to bill for them at a higher rate for patients with higher paying insurance programs. And so there's a sort of way for providers to earn a significant amount of income through the 340B program, which they argue they're using to continue and extend their efforts serving vulnerable populations. Okay, so that's the background, Jeff.
Okay. And as a quick aside, it's the Coast Starlight.
Oh, thank you.
Yeah.
Okay, the train. I've heard it's beautiful down the coast. Yeah.
Same.
Okay.
Same. Haven't seen it myself.
So in California, there's this ballot measure that's basically says you have to spend 98% of the net revenue from this program on direct patient care. Sounds good, right? Well, the ballot measure was written in such a way that it would only apply to certain organizations. Those certain organizations have to spend more than $100 million on things other than direct patient care in the last decade, and own and operate multifamily housing units with at least 500 high-level violations. What? That is oddly specific, no?
Right.
Well, as it happens, there's really only one organization. It's the AIDS Healthcare Foundation, which operates HIV clinics in California and across the country, as well as providing housing to the extent that is described in this ballot measure. So really, this is a campaign to target this one specific organization and force them to spend the revenue they earn through the 340B program on patient care. Now, why is this an issue at all? Well, there's a number of entities and stakeholders who are not fans of the AIDS Healthcare Foundation. That includes some housing advocates who accuse them of operating housing units at in poor condition, and then there's also folks that saw the AIDS Healthcare Foundation oppose certain efforts to expand housing development in the state of California and advanced rent control provisions as well through ballot measures. And so organizations like the landlords and the developers are not fans of efforts to impose rent control. And so this ballot measure is a real kind of hot potato in between these two fighting factions. So it's going to be really interesting to see what comes of it.
Yeah, I was going to ask, would you call this a spite ballot measure?
I think I would. That reminds me, do you remember when Jerry Seinfeld had to try to return a jacket that somehow he was angry with the salesman, and when they asked him why he wanted to return his jacket, he said it was for spite. So
I don't remember that specific plot line, but that sounds like something that would happen on that show.
The spite ballot measure. Yeah, I could see that.
Yeah. Well, Rob, thanks for joining us today on Health Affairs This Week. It's always good to, end an episode on a spiteful action. And with that, thank you for joining us today on Health Affairs This Week. I hope you and your family have a lovely Halloween.
Likewise.
And to you,
Jeff. Yeah.
Thank you. And to you, the listener, please send this to the Optimus Prime in your life, and hope to see you next week. Send it to a friend. Take care.